just want to welcome everybody here. I'm Michael Eigenram, Chair of aHUS Canada. So I was asked to speak some words of welcoming before we get started. I'm an aHUS patient myself. I've had aHUS since 2002. As you can tell, I'm not a public speaker, but I do have a passion for helping people that are in dire circumstances, and that's why I'm involved. My wife, Marguerite, you've all had communication with. She's acting as secretary of the board, so we work together. So welcome all patients, caregivers, sponsors, speakers. We're so happy to have you here, and we're looking forward to a really good day. There are some patients and caregivers here that we've just recently met, so they don't know us, and some people we met a while back, they probably still don't know everything that we do. So I just want to give a little rundown of what we do as aHUS Canada. If I could ask all the board members to stand up just for a moment so that you know who in the room are board members. So we have 7 of us here of 9. 2 of them couldn't make it. So we have Nancy Lafleur here, Karen Vowles, Sonia Girato, Tom Curlow, Mary Jane Vowles, Marguerite Eigenram, and the 2 that aren't here are Jennifer Anaquad and Bryant Harburn, and they're both from the Vancouver area. We're all volunteers. We don't have draw salaries, and we all either have aHUS or we're caregivers of someone with an aHUS diagnosis. It's a non-for-profit organization set up in 2012 with a mission to support all Canadian aHUS patients and their families through community building, public awareness, and advocacy. We started off in 2012 with a patient evidence submission going to the Canada's Health Technology Assessment Agency with regard to the first available therapeutic. And as a board of directors, we were formed shortly thereafter in 2013. And we've had 3 annual conferences in a row following that year. And then we had to stop for other reasons. And from 2013 to 2017, most of our work was all in advocacy. So basically we were struggling with the provincial governments because Health Canada gave the okay to market the therapeutics in Canada, but then it went to the Health Technology Assessment Body, and they came up with a recommendation that it was not worthwhile for the provinces to fund it, which was mind-boggling to us and shocking because we knew how effective the therapies were. So that's what was motivating us to get involved with aHUS Canada and do something about it. So those years, 13 to 2017, we did a lot of advocacy. We started in Ontario, pretty well exclusively, so that we hoped that because a lot of our board members were in Ontario, not all of them, but most of them, we thought if we concentrate on Ontario and get Ontario to change their mind to fund the drugs, then maybe the other provinces would follow suit. And that strategy actually ended up working, except for one province, BC. In 2017, they still had not decided to fund. So there was a case of a young girl, 20 years old. She was a UBC student. She was dying in the hospital with aHUS. She had the proper diagnosis, and the health minister who was making the decision told the mother of this girl that he wouldn't fund the drug, straight to her face. And then we decided we had to do something about that. So we started a media campaign in BC. That was also successful. He changed his mind because of the public pressure. And so that was also good. Since then, we've submitted a patient evidence submission to the Health Technology Assessment Agency for the second treatment. And that was also very successful because the Health Technology Assessment Agency actually ended up saying, we do recommend the provinces to fund this drug. So with our help and the work of the drug company, it all worked out well. So now we have 2 therapies on the market. So I just want to thank a bunch of people here, all the people that are participating in the conference. I hope that you all are going to participate with questions, because there's going to be question and answer periods after each session. So feel free to raise your questions. I've gathered some questions that you've raised on those boards from yesterday and today, so I'll share those as well. Thank you to the whole board for all the planning you've done. It's been a lot of work, but it's going to be very worthwhile, I feel. And I want to especially recognize Marguerite because of all the work she's done. I've seen firsthand what she's been doing, so I know it's been a ton of work. Also want to thank our event planner, Zilla, for a tremendous effort in making this all come together. Thank you to all the speakers for being here, all your effort in getting here and spending time with us on a Saturday and sharing your expertise and preparing your presentations. Thank you very much. Yeah. And lastly, but not least necessarily, to our sponsors. Without you, we couldn't have this conference. So thank you very much for your support. So I have gathered a bunch of things from last night. I'll share that with you. We talked about framing the day with some ideas about what we're hoping to get in and out of this conference as patients and caregivers. So I'll just share what we've gathered, and then maybe we can work from there. And then at the end of the day, maybe we can talk about what we've actually achieved as opposed to what we're hoping to achieve. So we'll start out with what we're hoping to achieve. So these are some comments that we gathered yesterday. I didn't retain much from the last meeting 10 years ago. So I hope to learn much. Okay. I hope to learn a lot about genetics of aHUS, somebody else commented. I hope to gain more knowledge about the disease progression and transitioning from pediatric to adult care. I want to learn how to cope better with living with all the bad symptoms. I like to have the opportunity to build community. This is why we're here. I like to hear from other patients and hear their experiences, share our experiences and what we've learned. I want to relieve some stress. So there's a mental health question there. I want to get updated on info on aHUS research and treatment options. So that's kind of some of the ideas we've had about from the patient community about what we're hoping to achieve today. Then I had some very specific questions that was on the other board. So maybe the presenters can pay attention to some of the questions because they might pertain to you. How many people have been diagnosed in Canada? No one knows this answer, of course, but it's a question. What are the chances of relapse after infusion has stopped? What kind of prevention steps can we take to stop relapses? Why can you find a mutation in some patients and unknown markers in others? What does it mean for me if they have not found any genetic mutation? What is factor H autoantibody mediated aHUS and how common is it? What's the difference between primary and secondary aHUS? Dr. Licht, am I reading too fast? What is the MCP mutation and how different is it from the other mutations? Is it safe to stop treatments? What happens when you stop? Does it depend on your mutation? How often should we have follow-ups once treatment stops? Are there stats or information about patients stopping treatment? What steps should be taken to get genetic testing? What is the status of the pill version of treatment? can I donate blood? If I have kids, will they get aHUS? And lastly, but not least, can I get tattoos? If I may, is there anything that could go wrong? So those are some of the thoughts that came from the community. So I'll start with now introducing the first speakers. So please refer to the agenda for the timing of everything. There might be some changes during the day. One of our speakers is arriving late, so we'll have to see how that goes.